Hi, my name is Maddie Nance. I am a graduate nursing student at West Texas A&M University, obtaining my Master of Science in Nursing degree, specializing in nursing education. My passion for nursing education has been influenced by my background as a nurse in the neonatal intensive care unit. Today, the topic for my final presentation is classroom and clinical student evaluation, where we will be covering the types and methods of evaluation, how to navigate this as an instructor, challenges, and how to successfully implement this to ensure that students are meeting the desired learning objectives and competencies. First, it is important to understand what the definition of evaluation is. According to the textbook, Evaluation and Testing in Nursing Education, evaluation is the process of making judgments about student learning and achievements, clinical performance, employee competence, and educational programs based on the assessment data. The process of evaluation is therefore significant as it tells us, as nurse educators, about the quality, value, and worth of the learning. Evaluation allows us to see how well did the student perform, and is the student competent in clinical practice? Evaluation is the key to understanding if the students met the objectives and learning competencies which will allow them to progress through their nursing courses. There are two separate methods of evaluation which I will be discussing next, which include formative and summative evaluation. The first method of evaluation is formative evaluation. Formative evaluation is when the teacher judges the quality of the achievement while students are still in the process of learning. For example, you as the instructor will provide feedback to the students during the instructional process. This can occur both in the classroom and in the clinical setting. In the classroom setting, the instructor can have group activities, quizzes, and other learning activities to observe where the students may need further instruction and also to see what they have already learned. In the same way, formative evaluation can be seen in the clinical setting, especially during simulation lab time. The instructor continually observes the student's skills, answers any questions that the students may have, and helps to guide their performance so that they will improve. Formative evaluation differs from summative evaluation as it is not usually graded and is instead used to help students during this time of ongoing learning. It has been found that formative evaluation and assessment can help predict student learning outcomes, and aligning formative evaluation with learning objectives can lead to success. The second method of evaluation is summative evaluation. This occurs at the end of instruction to see what the student has learned and achieved. Rather than evaluating the student's progress, like in formative evaluation, summative evaluation is instead focusing on the quality of the student's achievement in the course. For example, this can be seen in midterm examinations, final examinations, or even final simulation clinical performances at the end of the semester. This is where the student will be ultimately graded on their achievements and performance. First and foremost, in order to ensure successful evaluation, you must have learning objectives and competencies that are mentioned straightforward in the course syllabus prior to the class beginning. These provide a basis for the students to be assessed and evaluated. This not only prepares you as the instructor for what you need to look for in your evaluation, but it also sets the expectations for the students. From here, you can judge the students effectively and refer back to the learning objectives and competencies to see if they successfully achieved their goals. Learning objectives and competencies ensure that there will be fair evaluation and provide the standards and expectations for passing the course. Likewise, they also assist the students in preparation for exams where they will be evaluated. In this slide, I have included examples of basic learning objectives that came directly from the NCLEX RN 2023 test plan. Each represents a different taxonomy domain, which allows you, as the nurse educator, to evaluate specifically what the student has learned at the end of instruction. The first learning objective that states prepare and administer medications using the rights of medication administration belongs to the psychomotor domain. So this psychomotor domain involves demonstrating competency in an actual motor clinical skill. And here the student would meet the learning objective if they are able to competently prepare and administer medications according to safe practices with the rights of medication administration. The second competency, which states assess the client's readiness to learn, learning preferences, and barriers to learning, belongs to the cognitive domain. So the cognitive domain focuses on higher level thinking, clinical reasoning, critical thinking, and clinical judgment. The student will show competency in this domain if they are able to assess the patient and respond appropriately. The last objective from the NCLEX RN is acknowledge and document practice errors and near misses, which belongs to the affective domain. The student shows competency in the affective domain when they are able to reflect on their values and use them in patient care. Overall, it is crucial to include learning objectives in your course in order to properly evaluate the student's achievement. In order to evaluate the student, you must first have forms of assessments that will display the student's knowledge. There are many different forms of assessment in the classroom, which can involve exams, quizzes, presentations, case studies, discussions, or group activities. These all can serve different learning purposes. However, they all allow the instructor to gauge what the students have learned in the evaluation period. Going back to formative and summative evaluation, formative evaluation can be used during group activities, case studies, or discussions to help students improve their learning and to provide feedback during these high-level learning activities. Exams, quizzes, and presentations can be used in the summative evaluation to determine the final outcome of the student's achievement and grade the student based on the quality of their performance. In this next slide, we will be discussing evaluating online courses. The challenge for nurse educators when it comes to evaluation would be online courses. Online courses present a unique challenge as there is not a traditional face-to-face classroom environment. Online nursing instructors must learn how to navigate evaluation and improve test security. Virtual proctoring or open book examinations are commonly used strategies to prevent cheating. Other challenges would be creating course assignments that are online that will still meet the learning objectives. Discussions are a great way to still examine and evaluate the cognitive domain, and students can provide feedback and discuss topics with their peers. Despite the many challenges, the key to successfully evaluating students in online courses would be to ensure that there is feedback that facilitates the student's learning. Next, we are going to be talking about fairness and grading. So grading is an important part of the evaluation process. For traditional classroom courses, nursing instructors should formulate a test plan or blueprint ahead of time. A test blueprint or test plan reduces the risk for test item errors, allows the instructor and students to plan for the material to be covered on the examination, and allows the instructor to stay organized when scoring the items after the examination. Clear instructions are also an important part of evaluation, as unclear directions can lead to errors or confusion for the students, which can impact their scores. An answer key allows the instructor to accurately check and score the students' examinations and improves evaluation efficiency. The environment also plays a role in fair evaluation. The instructor should ensure that the environment is quiet and that there are no additional materials brought into the examination room that could lead to cheating. Proctors should also be present to ensure fairness in the evaluation. Lastly, scoring should be a careful process that allows the nursing instructor to evaluate whether the test items were fair, reliable, and valid based on the student's results. After all of the examinations have been scored, the nursing instructor can then host a post-examination review discussion where feedback can be provided and the students can ask questions. Overall, these are all ways to ensure fairness in the evaluation process. Next, we are going to be discussing additional services for students. Along with fairness in evaluation, nursing instructors have an ethical and legal obligation to provide testing accommodations to those with disabilities. The Americans with Disabilities Act allows qualified students with a disability to seek testing accommodations. Once students have been qualified, nursing instructors must maintain these accommodations to ensure that evaluations are fair for all of the students. An example of a testing accommodation might include additional testing time. Overall, it is our role as nurse educators to make students aware of potential accommodations at the beginning of the course so that they can be successful in their evaluations. Next, we are going to be covering clinical evaluation. The overall outcome for clinical courses is that it allows students to apply the knowledge and concepts that they have learned in the classroom to real-life patient scenarios where they can practice nursing skills. Evaluation of clinical courses is vital as students must be able to competently meet the standards of nursing practice when caring for patients. Evaluation will still involve both formative and summative evaluation. Formative evaluation will involve teaching students and allowing them to practice their learned skills in the clinical setting or simulation lab. Summative evaluation can be seen at the end of the clinical practicum or at the end of the year skills checkoffs. There are many ways to evaluate students, either with direct observation of their skills as the instructor or through preceptors. Preceptors are role model nurses that help guide and teach student nurses in a clinical setting such as a hospital. Overall, at the end of the day, it is the responsibility of the nursing instructor to ensure that the student is safe to practice in the clinical setting. For successful clinical evaluation, students must have continual feedback regarding their performance. Student performances should be constantly discussed so that students are aware of their strengths and weaknesses and how they can improve. A learning contract is a beneficial tool for the teacher, preceptor, and the student to have an agreed upon plan for learning activities with set expectations. This plan for learning allows the student and instructors to both agree on the learning competencies and objectives. From here, the student can discuss any concerns with the instructor or preceptor. Identifying any problems with the learning activities early allows for earlier remediation, which will lead to the student to be successful in the end. Altogether, this allows for better collaboration between the student and the instructor, where they can both work towards a common goal. A rating scale or a clinical evaluation tool is used to evaluate students in the clinical or simulation setting. Rating scales can be used by both instructors or preceptors. Rating scales are typically used as a form of summative evaluation when the student's skills are judged at the end for quality of their achievement. On one side of the rating scale, the instructor will have listed objectives and competencies. On the other side of the scale, the instructor will have a means of scoring or rating the student on their performance. Students may be rated with numbers such as 1 being bad or 5 being excellent. Students may also be rated with qualitative labels such as excellent, very good, good, fair, or poor. Another way to evaluate students in clinical courses would be checklists. These are especially useful for the simulation lab. The checklists include every step of a nursing skill or procedure that they must perform. The students are able to practice performing the skill in the proper sequence. When they are finally ready to have their skill evaluated, the checklist is an organized way for the instructor to grade the student based on the steps that they use to complete the procedure. Another strategy to use during clinical evaluation would be to keep notes about the students. Observation is difficult, as the instructor may not be able to remember all of the observations of the students or manage observing them all at once. Taking notes allows the instructor to remember patterns of the student's performance and any impressions that were excellent or may need improvement. It is important to keep in mind that observations are subjective and a student's performance may only be a sample of how they typically perform or practice. Therefore, keeping notes would help the instructor to have a better idea of the student's performance over time and patterns of their performance. According to Evaluation and Testing in Nursing Education, self-assessment is the ability of students to evaluate their own clinical competencies and identify where further learning is needed. With self-assessment, students can uncover their strengths and weaknesses in the clinical course. This plays an important role in evaluation, as the student and the instructor can make a plan to further learning where it is needed. Feedback can be provided by the student and the instructor, and the student's perceptions can be shared regarding their own progress in the clinical setting. Nursing instructors must remember that a positive and supportive environment is needed during this time, so that communication can be enhanced and students will feel comfortable sharing their concerns and feedback. A concern for evaluation, whether in the clinical setting or in the classroom setting, would be bias. Going back to clinical evaluation tools, nursing instructors must ensure that the tools and ratings are consistent and fair for all students. A way to eliminate bias would be to continue to hold post-clinical conferences with students to share feedback regarding their performance in accordance with the rating scales and evaluation tools, so that students understand how they were fairly graded. Sharing checklists or rating scales ahead of time also allows the students to understand the expectations prior to clinical and see how they will be evaluated. Peer review is another strategy to ensure that students are evaluated fairly and that bias is eliminated. Having more than one instructor judge the student's clinical performance can improve consistency in their evaluation and ensure fairness. Because, as we have learned, observations are subjective to the individual instructor, and having peer review will allow additional opinions about the student's performance. These are all tools to help eliminate bias and ensure that students all have equal opportunities to succeed. As with classroom evaluation, clinical evaluations can have a significant effect on students' anxiety and self-esteem. It has been found that students in higher level courses with clinicals experience extreme stress, and as nurse educators, we must provide additional support and create a positive learning environment for our students. Because most clinical courses are graded as pass or fail, this adds to the pressure on their performance. Being open to remediation or additional practice for students will allow them to feel more at ease during their final evaluation checkoffs. Continuing to hold conferences with students will allow them to express their concerns and for the nursing instructor to help them seek additional support services as needed. When students are unable to practice safely in the clinical setting, nursing instructors must follow the nursing school program's policy for failure. However, there are many steps that the nursing instructor should take prior to failing the student in the clinical course. The first step would be documentation. The nursing instructor should always keep documentations of the student's clinical performances, their rating forms, and notes. Additionally, the nursing instructor should review the student's performance with the student and have them sign their evaluation forms. Even if the student does not agree with their performance, this serves as documentation that the nursing instructor reviewed their evaluation. This also allows the student to share feedback and have the opportunity to even share and write their own comments on the evaluation form. Again, problems should be identified early so that students have the opportunities for additional support services or practice so that they have the opportunity to improve their skills rather than failing. In the end, if the student has been given opportunities to improve their performance, yet the instructor and preceptor do not see the student as safe to practice, then the instructor must follow the nursing school's policy for failing the clinical course. Students should be made aware of the expectations and policies for passing the clinical course at the beginning of the semester. As nurse educators, we are held to professional standards. Students deserve confidentiality and privacy regarding their test results. It is our job to ensure that tests and forms of evaluation are fair, reliable, and accurate. We are also responsible for the quality of the tests and selecting tests that are appropriate for the intended use. In the end, we must ensure fidelity and trust in the evaluation process and ensure that communication and feedback are effective. All student concerns should be treated and reviewed seriously so that instruction can be improved. All in all, nurse educators must act in the best interest of students to ensure that they are receiving the best nursing education possible, which will lead them onto a successful career as a nurse. Overall, through this presentation, we have learned the importance of classroom and clinical student evaluation. Evaluation plays a critical role in determining the quality of learning as well as the achievements of students. Both formative and summative evaluations are seen in the classroom and clinical setting to determine if the students have met the desired learning objectives and competencies. There are many different tools to evaluate students in the classroom and clinical setting, and we have learned that feedback is one of the most important parts of evaluation to determine where we can improve. Although there are many challenges with evaluation, such as bias, we must uphold our ethical obligations and professional standards to foster a positive learning environment built on trust, fairness, and privacy. Here I have placed my references. Thank you for listening to my presentation covering classroom and clinical student evaluation. Thank you.